Responsible for the health care of 500,000 people, military medical units in the Gulf have had much more to do than treat the wounded. Eugenia Halsey reports the task includes care for the growing number of women in the military.
One of the first images of the ground war, female officers piloting supply choppers. Women make up about 6% of the U.S. force in the Gulf, and although they're banned from direct combat, their jobs do put them at risk.
For the most part, I think they're worried about the same thing the guys are, and that is getting wounded by shrapnel, gas attacks.
The Pentagon says women have ready access to health care. 20% of the Army's obstetrician gynecologists are in the theater of operations.
Initially, we raised the issue of whether just the remoteness, the hostile environment might present some particular problems to our female soldiers, primarily because of the lack of adequate facilities for personal hygiene, or the added stress of that environment might create some menstrual irregularities.
But 6 months into the conflict, Dr. Broadnax says women have not been a burden. Only about 70 have been evacuated from the Gulf for medical problems common to women, such as pelvic or abdominal pain, ovarian cysts, and in some instances, pregnancy. Military policy is to send pregnant women back to bases in Europe or the U.S. immediately. Like the men, women have also been treated for broken bones and for food poisoning. But some argue the war poses a few additional challenges for women.
Many of them are mothers who are separated from their families, which adds stress on top of being in a combat zone, and also the additional stress of not knowing how women are going to be treated if they're captured.
There are unconfirmed reports of Iraqis raping Kuwaiti women. Iraq also is said to be holding a U.S. woman as prisoner of war. Meanwhile, officials say obstetrician gynecologists are playing a dual role in the Gulf. Not only can they treat women for routine problems, their special surgical training is useful during emergencies.
Especially where large numbers of casualties are involved and where there's multiple trauma. And I'm talking about measures such as stopping hemorrhage, treating hemorrhagic shock.
Long before women showed up in war zones, the U.S. Army decided to use gynecologists during wartime because of their surgical skills. Now that so many women are serving in harm's way, that strategy is paying extra dividends.
The Allies